This is going to be my audience for my informative speech. Now I'm going to give it to the video guy. Okay, celebrities and magazines, televisions, and other forms of media, they portray the so-called image of the perfect body. What truly is the perfect body? Is it being thin, being curvy, or being a bit on the large side? I don't think anyone really knows and can be the judge of their shape or who anyone else's shape is. But when an audience tries to transform their bodies into what they see in the magazines, it can cause them to resort to having an eating disorder. When I was in high school, one of my best friends was anorexic. It was hard going through the years, and it had been going on for so long, but no one had known, and they didn't realize until she had become her thinnest. It was really hard seeing her go through something like this and me being so close to her. And today I would like to talk to you a little bit about the different types of eating disorders, which are anorexia, bulimia, and obesity. Anorexia, it can be described as a psychological disorder. It is a disorder characterized by an obsessive desire to lose weight by refusing to eat. According to an interview by Kat Saunders, anorexia can be accompanied by a lot of exercise or diet pills or extreme weight loss. The weight loss gets to the extreme point where it can become an obsession, which can be similar to an addiction. At this point in time, there is no cause to the disorder, but scientists continue to do the research, and the disorder has come up with many theories to it, but they believe it could have genetic components or may have a role. This may have a role in the developing of anorexia. There's also been thoughts that there may be a dysfunction in a part of the brain, which is the hypothalamus. This part of the brain controls certain metabolic processes. Also, when you are a child, being underfed or any other feeding problems that you may have when you're an infant can tend to be a risk factor for anorexia also. About 95% of the female population, in most often teenage girls, are prone to develop the disorder. Although it is more common in women, it is also possible in men. Caucasians are also more commonly known for having the disorder. But no matter who has the disorder, it is difficult to diagnose for anyone because many go through denial and they want to be secretive about the disorder. Many people who are affected with the disorder will not seek professional help. Therefore, the disorder usually goes through diagnosis until another medical complication comes up when they have to go to the doctor. There are a few major factors in diagnosing anorexia, and these can be maintaining your body weight, huge fear in gaining weight, also like your self-perception, looking in the mirror, seeing yourself in a different way. They see themselves very distorted, and many women who have begun their menstrual cycle tend to miss periods when they are anorexic. Anorexia can be treated in two different ways, either through outpatient care or hospitalization. But the main goal in the treatment is for the patient with the disorder to just gain weight. And without the treatment, the disease or the disorder could be fatal. The earlier it is diagnosed, the better they can overcome it. But this isn't the only type of eating disorder. There is also bulimia. And bulimia can be described as the excessive amount of eating followed by inappropriate methods of weight control. There will be vomiting, excessive laxatives, or excessive exercising, just like anorexia. According to the Mayo Clinic, they said that it commonly is followed by vomiting. But in the same aspect as anorexia, bulimia has no definite cause. It is thought that it will begin with unhappiness with one's self-image and causing them to become depressed, in turn cause them to eat more, which will result in them vomiting. It is also estimated that 3% of the women in the U.S. at some point in their lifetime will have bulimia. And also, surprisingly enough, about 10% of the bulimics are men. Although these people with bulimia also suffer from weight loss, it isn't as noticeable as anorexia. Bulimia can be diagnosed in a few different ways, including repeated episodes of throwing up or binging and lack of control over eating. You need to try and control the weight and prevent the weight gain, not prevent the weight gain, and no binge eating should occur. But when it does begin to occur 2 times a week, that's when you know that bulimia is occurring. Although it doesn't have any serious side effects as the same as anorexia, it does still have consequences, most likely from the binging and purging. By making yourself throw up, it can cause your teeth to decay, it can cause sensitivity to your foods, the hot and the cold, and also relating back to anorexia, you can also have the missed periods if you're a woman and are bulimic. Bulimia can be treated in a bit of a different way than anorexia. With bulimia, you can take medicines. Antidepressants have been known to help with the disorder. Also, patients can be hospitalized, and many need to be monitored weekly or while they're in the hospital in order to be stabilized. And the other eating disorder I would like to discuss with you is obesity. This type of disorder is a little bit different than the other two. It can vary in definition. It can be defined as an excessive amount of body fat. Obesity has become very common in the United States in the past decade. It is said in 1 in every 3 Americans they are possibly obese. The problem with obesity is that it is followed by many health risks. There are thousands of deaths per year that are directed towards obesity, but not only can it cause death, it can increase many things: type 2 diabetes, high blood pressure, cancer, gallstones, high cholesterol, or even a stroke. But unlike anorexia and bulimia, obesity can be caused by a number of things. A person's genetics can cause likelihood of obesity. If both of your parents are obese, it's more likely that the child is going to be obese. There's also overeating, which can lead to weight gain, and many others with frequent eating and slow metabolism, no physical activity. This can all cause obesity. It is difficult for obese people to lose the weight because oftentimes people will diet, lose the weight, but then continue to eat and gain it all back. And in order to treat obesity better, we will have to learn more about it to understand how to treat it for these people. What many obese people don't realize is that the smallest amount of weight loss can be beneficial to their health. Exercise is the most important. Dieting, it can help them in achieving their goals and weight loss. And medication can also be administered if the person with the disorder has a health risk, like the diabetes or high cholesterol. And after reviewing all these 3 different types of eating disorders, anorexia, bulimia, and obesity, you can see that there are so many different signs and reasons as to why these disorders have developed. In order to prevent these, I hope I have educated you on a few of them. And if you know someone or hear of something and you think you can help them, I hope that you can help them with whoever could be struggling with one of these disorders.